Preparation before treatment. The doctor should discuss with patient to understand their treatment demand and target results. It's important to inform the patient that the procedure is approved by professional doctors and is very safe. Let patient relax will help us to do next step. Prepare necessary items before the treatment, including topical anesthetics, medical facial mask, tissues, facial cleanser, makeup remover, protective goggles for both doctor and patient, clean towels, antibiotic ointment, 75% medical alcohol. Doctor should answer patient questions and guide them to fill the fractional laser treatment informed consent form. Based on the treatment purpose, select the correct laser head, scanning type, cutting type, or private treatment type. Treatment procedures. Before treatment, clean the treatment area. Use facial cleanser or makeup remover to clean the skin. Apply topical anesthetic. Apply anesthetic cream to the treatment area and cover with plastic wrap for about 30 minutes to improve absorption. After the anesthetic takes effect, clean the face again. Both doctor and patient must wear laser protective goggles compatible with the 10,600 nanometer wavelength. Take pictures of the treatment area before the procedure to check results later. During treatment, set treatment parameters. According to the treatment parameters, set the appropriate parameters on the interface, like energy, fractional mode, pulsar type. You can also adjust them on the screen of the handpiece. Recommended energy, 15 to 20 watt. Apply laser evenly. Move the handpiece evenly across the treatment area. Avoid overlapping or skipping areas. If somewhere you want to do more deeper, you can turn around the handpiece with 45 angle and overlap once. After treatment, apply a medical facial mask immediately for 15 to 30 minutes to reduce redness and heat. Apply healing products. Use medical repair gel or growth factor gel. Apply 1 to 2 mm thick to improve healing. Cutting handpiece operation. Before treatment, disinfect the area. Use a cotton swab dipped in the 75% alcohol to disinfect the treatment area. Install the cutting tape. Remove the scanning tape from the laser arm and install the cutting handpiece. Both doctor and patient must wear laser goggles suited for the 10,600 nanometer wavelength. Take photos for recorders. Record the skin condition before treatment. During treatment, set treatment parameters according to the table. Recommended energy, 3 to 6 watt. For most erase lesions, use a point-by-point approach. For long walls, lift the end with tweezers and remove the base only. After treatment, disinfect the wound. Use sterile saline or iodine. Prevent infection. Apply antibiotic ointment. If there's monitor bleeding, press with the sterile gauze. Vaginal handpiece operation. Before treatment, disinfect the area. Clean and disinfect the treatment area to prevent infection. Wear protective goggles. Both doctor and patient must wear 10,600 nanometer wavelength goggles. Treatment steps. Adjust the fractional laser settings, energy, density, depth, based on the patient's needs. Insert the appropriate vaginal treatment tape and apply laser in 306 angles, motion along the vaginal.